Millions of Americans are now eligible to receive a Pfizer booster shot meant to increase protection against COVID-19. But there are questions about who is eligible and just how safe this booster can be. NewsNation's Felicia Bolton is getting answers for us tonight. And Felicia, who is allowed to get the booster shot?
Yeah, that's the big question, Ruta Bay. The Centers for Disease Control say if you already received the 2 Pfizer shots at least 6 months ago, you can in fact get the booster. But the recommendation goes first to people most at risk of having serious injury or even dying from COVID-19. The CDC says for people 65 and older, nursing home residents, and assisted living residents to get the booster right away. Others 50 to 64 with high-risk health problems like asthma, cancer, diabetes, heart disease, and HIV should also get it. People with severely weakened immune systems are already eligible to get a 3rd dose of Pfizer. They do not have to wait 6 months to get a 3rd dose. The Centers for Disease Control and Prevention says these people may get a booster, but they did not issue a full recommendation. People 18 to 64 who got their Pfizer shots at least 6 months ago with risky health problems. Anyone 18 to 64 who are considered frontline workers can also get the shot. These include healthcare workers, grocery workers, people in homeless shelters, prisoners living in close capacity, and school teachers.
Even though I wear a mask at all times, not all the children and adults that I work with choose to do that. And so, if I get that booster, that makes it significantly less likely that I can spread it to all of those people I work with.
And the FDA says common side effects of the Pfizer booster shot include pain, redness, and swelling at the injection site, also fatigue, headache, muscle pain, joint pain, and chills. Sounds really scary, but there is some good news. These side effects only last for a very short period of time.
So is there anything keeping me from waking up, walking into a pharmacy and just saying, I want the booster shot?
Yeah, and then there's also the people that want to mix and match if they have Moderna or Johnson & Johnson. Well, if you have a good pharmacist or a very good doctor, your vaccine card is going to be all they need in order to determine that. It's going to have the date and also the brand on it. A really good pharmacist or doctor will also know the timing of that shot and the brand specifically, and they'll let you know if it's too soon. And they're also they're not going to mix and match shots right now, Ruta Bay.
Felicia, thank you.
A little bit more about this. The approved booster could lead to billions of dollars for drug makers. Employers are already beginning to plan for clinics to administer that 3rd shot.
Now that we've been approved for Pfizer as a booster, we're going to add that to our flu clinic that we have for staff, which will start on October 7th.
The shots are paid for by the federal government, but financial analysts say the booster could provide a huge boost to the economy.